Okay, guys, we're going to be talking about contracts in healthcare today. So, contracts are agreements that occur between two or more people, and they are enforceable by law, which doesn't mean that you can't get out of your surgical agreement if you've signed it, but it means that your doctor or your care provider must abide by the contract that you have made. Now, there are two types of contracts. One is implied contracts. So these are non-verbal agreements. So if you walk in your patient's room and you tell them you're there to draw their blood and they stretch their arm out for you, this is an implied contract. They have agreed to allow you to draw their blood. Now, expressed contracts are stated clearly in terms of agreement, and this says that they can be oral or written. And typically, if a doctor's getting ready to do surgery, they'll come in your room and they'll talk with you and your family, and they'll ask if you have any questions after they've explained the procedure and everything that is going to happen, and they've explained all of the risk and possible complications. And this is what is called an informed consent. And at that point, after you are made aware of everything that could go wrong, or you are told about things that might go wrong if you don't have the procedure done and what the expected outcome is, then you are able to sign your surgical consent form. So, informed consent can only be given if you completely understand all of the possible outcomes of the procedure that is being done. Informed consent is an essential component of healthcare. We need our patients to understand what we're doing and what the possibilities are, so that they are not surprised if something goes wrong, and so they understand the risk when procedures are done. Now, informed consent can be given by the patient, or it can be given by a healthcare power of attorney, which is someone that would be named by the patient to make medical decisions for them if they were unable to. Now, there are a few people there are some legality issues. So, of course, you can't enter into a contract that lets you do something illegal. For example, you cannot sell your kidney. I know some of you think that might be a good idea, but that's not something that the law will allow you to do. There's something else called the legal ability to enter into a contract. So some people are not able to enter into contracts because they have a legal disability. So this is someone who cannot legally enter into a contract, so they can't give permission for their own procedure or needed care. So first you have minors, people who are under the age of 18, unless they are married. At that point, they would become emancipated adults. If you are mentally incompetent, then you would not be allowed to enter into a contract. If you are under the influence of drugs and alcohol, and of course what most people think of here is if you have someone come into the emergency room and they're in an accident and they've been drinking or they've been using drugs. But this also gets into some other areas for us in healthcare. If we have a patient who's getting ready to go to surgery and we give them their pre-medication, so give them some Valium or some Xanax to relax them, their pre-surgical meds, and then someone goes, oh, they never signed the consent form. At that point, they are under the influence of drugs, even though they're drugs that we have given them in the hospital, and they can't sign a consent form. That would also apply to patients who are taking pain medications. So narcotic pain medications, they would not be able to sign their own consent forms. And I sort of think it goes without saying that the unconscious patient or the semi-conscious patient would not be able to sign their consent forms because they would also be considered to have a legal disability. So this is what you need to know about contracts, and we'll talk more about the way that healthcare providers break contracts either intentionally or accidentally when I see you in class again. I hope you guys are having a good week.